My name is Debbie Hodge. My job role is an occupational therapist practitioner. There is a lot of background sort of like work that goes on that people don't realise, because it's not just about going out and seeing people. There's a lot of preparation or work that needs to be done beforehand. Occupational therapy work is initially try to resolve what we can in the first instance to prevent any kind of further deterioration. It's been about 10 years now, or near enough, that I've worked for South Tyneside. Obviously the service adapted and I was given a role as part of the occupational therapy team alongside with social care. There's no typical day. Every day is different, because when you do go out, there is a stigma especially with older people. You can go into a visit and it's like, I'm not going into a care home. So you will then have to say to them, that's not what I've come here for. And it's trying to reassure people you're there to actually help them remain in their own home. And that's part of our role, is to keep them as safely as possible, whether in their own home. Obviously we have to go out, be professional. We have to be open and honest. And one of that open and honesty is we'll do everything we can to keep you with your wishes, and we'll listen to you to keep you at home. I enjoy most, I suppose, helping people to keep them in their own home, because ultimately that's what they want. They don't want to move. You can see people struggling and they're in pain, which is not nice to see. You've got to be holistic in whatever you're doing to provide the support. So when you get that outcome for that person and they're going to be able to manage and reduce lots of risks associated with what that is really, really satisfying. We have a great team. Although I'm just one, we're all one big team and we're all supportive and they're there for you. I really do feel valued within my job, because if I can justify what I am requesting to be done, they will back me up 100%. So that autonomy that you have gives you a great, immense feeling of satisfaction, that one, you've actually looked at things holistically on a whole, you've thought of other solutions, and this is the best way forward, is actually really, really satisfying. And it's about working around them with what we can actually do, which is challenging, but when you do that challenge and you've met that outcome, it's quite satisfying and rewarding. Why do this job? If you're interested in not just in social care, but making a difference to people's lives, then it's something you really need to consider. Social care is a very wide scope in how you help fulfill people's needs and wishes. For somebody coming in, it gives you a lot of job scope to be able to develop your career. So I would encourage people to actually, really look into doing the role and see what it's all about.